Thank you for watching Studio 7 from the Permian Basin Chevy dealers.
Welcome back. When you look in the mirror, do you notice some things about your face that you wish you could change? Maybe you're starting to notice some lines that look just a little deeper, or maybe you have some scarring that has always bothered you. In this week's Ageless Beauty, Dr. Ritchie Rosso is here. He is a dermatologist at the Laser and Aesthetics Center. I'm really excited about this topic because, I'm kind of an open book about this, but these fine lines that we get as we begin to age, it's nice to know there's something that can be done about this. We're talking about the deep laser resurfacing. You say it's for wrinkles, acne scarring, tightening the skin. It's pretty revolutionary, right?
Well, it is. And lasers have been around now for a few decades, actually, but they've really come a long way in the last, I'd say, 10 years.
Okay.
And now we've got some great options that are what we call minimally invasive procedures using laser technology that go into the skin and do some tightening. They do some scar revision, and they also do a lot of rejuvenating. And just like you said, lines and wrinkles are certainly amenable to this treatment. Acne scars can be improved with these treatments. Also pores and texture, the surface of the skin.
Okay, so I want to show some pictures, some before and after shot. When I first saw this and you walked in today, I said, this is me. Like, you're speaking to what I think a lot of us, early 40s, is what we're seeing. When you look at this picture, I see the discoloration, even the quality of the pores is larger. The before and after is remarkable. What did she dislike? What were her issues to begin with?
Her lower eyelids were an issue for her. If you can see on the before picture, she had a lot of fine lines on the lower lids. We call that crepey skin, and that's very common.
Okay.
And that's just a tired look that happens with aging and also with stress, actually. And then the pores were an issue. She wanted to minimize the pores as best she could. And she also just wanted a brightening effect, just wanted to feel and look a little bit younger. So if you notice on the right, the lower eyelids are improved. And we did what's called the CO2 laser on her, which is the more aggressive of the deeper lasers that we do.
Okay.
But it is the one to do, certainly, if we want to get that tightening of some of the wrinkles, and if we really want to get the full rejuvenation effect.
You said so many words that speak to me. It's brightening. She doesn't look as tired. She must have done the happy dance when this was over. She looks fantastic.
She did great. She did great. And we see results as soon as 1 month. And this was actually, I believe, her 2-month picture.
Wow.
But we continue to see improvement up into 6 months. And that improvement lasts. So this is not a treatment that is designed to be repeated within a year or not even within 2 to 3 years. This is something that is done only once in a while that can really rejuvenate. And it really takes a personal consult with the physician.
Okay.
And I am available at the Laser and Aesthetics Center on Friday afternoons, and I do consults myself. And we've got our head nurse, Sandra, who's there the rest of the week.
Yeah.
And it takes that personal consult because depending on skin type, depending on how much downtime the patient can afford, and then depending on their goals and what they really want to see improved, all those things are factors in which laser and which treatment plan we would design for the patient.
Okay, we talked a little bit about this. You're going to probably not be able to wear makeup for several days, right? About what do you advise people be prepared to be,
Yes, with the more aggressive treatment, the CO2 treatment, we advise a week. So we really want you to be able to have a week of downtime.
Okay.
And this doesn't mean you have to be in bed at home. This just means that if you're out and about, you're going to be showing evidence that you had something done, the week before. The less aggressive laser, one of those is called Fraxel, and that is another great one for acne scarring with less downtime than the more aggressive CO2 laser.
You guys have a big event coming up on September the 22nd. We spoke with Dr. Ho about this. You and Dr. Chappell will be there as well. It's not at your new beautiful center, which is pretty fabulous. It's at the Elegante. Tell me about this special event.
It is, yes. Dr. Chappell, before I joined him 3 years ago, has been doing this event for years, and it's become a really big event in our area for aesthetics. And it's at the MCM Elegante from 9 to 6.
Okay.
And it's on the 22nd of September. And I will be there most of the day, actually doing consults myself for things such as laser, but also some of the other services we offer. Dr. Ho plans on being there as well, and Dr. Chappell also.
You say this really attaches very well to medically and cosmetically what you do.
It does, because a lot of times people don't choose to have surgery done, and I'm a Mohs surgeon. I have to remove skin cancer from folks. And when we do that, we create scarring, even if it's minimal, that then using laser we're able to help and resurface.
Yeah. This is very exciting. Thank you for sharing this with us.
Sure.
Again, September 22nd is the event. If you have any questions, you can always call their office. They're great people, and they'll get you the information you need. Thanks for being with us today.
Thank you, Tatum. Appreciate it.